Hi, this is Josh, pharmacist with Pharmacist Tips. Going to take a look at medication Clonidine. We'll discuss some of the uses, common dosages, as well as side effects that can occur. First of all, let's look at an overview of Clonidine. U.S. brand names can include Catapress, Duraclon, Capve, and Nexiclon XR. It is an older medication. It was approved by the FDA in September of 1974. It is available in patches, injections, and tablets. It's used to treat high blood pressure, ADHD, anxiety, and pain, and some other uses like hot sweats, muscle spasticity, nicotine dependence. So specifically, the topics that we'll cover in this video include how it works, the uses, dosage, cautions, and some of the side effects. So how does clonidine work? Clonidine stimulates what's known as alpha-2 adrenergic receptors in the brainstem. Those receptors are responsible for controlling blood pressure and heart rate. In turn, it causes blood vessels to relax and heart rate to slow. Complete action in the body is not completely understood, however. What are some of the approved uses of clonidine? It is approved for treatment of attention deficit hyperactivity disorder, as we just mentioned, hypertension. Now, it is certainly not first choice for high blood pressure or hypertension. So it would be people with resistant hypertension resistant to treatment that would get clonidine prescribed to them. And it can be used for menopausal hot flashes as well. What about some of the off-label uses, meaning not originally approved for this use, but over time they found in certain situations it may be useful? ICU sedation, people going through opioid withdrawal, certain pain management. It may be used in an epidural, smoking cessation, as well as others as determined by your prescriber. Dosage in the tablets, the IR is the immediate release tablets. For hypertension or high blood pressure, it's usually started at 0.1 milligram 2 times per day. Now, it is not increased any quicker than weekly, and max dose is often 0.6 milligrams per day, so that would be 0.3 milligrams twice a day. There is an extended release tablet that is started at 0.17 milligrams at bedtime. Again, it's only increased weekly. Max dose on that extended release is 0.52 milligrams per day. Patches, the patches release 0.1 milligrams every 24 hours. The patches are replaced every 7 days, so that patch will last for a week. The dose on the patches, just like the tablets, is increased every 1 to 2 weeks. The usual dosage range for patches is 0.1 to 0.3 milligrams released per 24 hours. And when the patch is changed to a higher dose, we won't see the full effect for 2 to 3 days. So we have to approach dose increases gradually with clonidine. What are some of the things we need to be cautious about with clonidine? Low blood pressure. Anything that affects blood pressure, of course, we need to be mindful of taking that blood pressure too low, making us feel faint or dizzy, low heart rate. And if you stop it abruptly, you can get withdrawal symptoms. You could get, of course, high blood pressure, headache, insomnia, and excessive sweating. Some common side effects that we see with clonidine include rash and itchiness. That's going to be with the patches. Dry mouth and stomach pain can occur, dizziness, drowsiness, fatigue, headache. So with these sort of side effects, we would be really cautious before we would drive or anything that requires alertness till we know how this medication is going to react, till we know how we feel when we're taking clonidine. Other side effects, so less than 1 in 10 people report experiencing these side effects. That can include low heart rate, skin sensitivities, again with the patches. Some people can have a fairly strong reaction to patches, possibly the adhesive in there. They may be sensitive to that. We can see constipation, impotence, other sexual dysfunction, emotional or behavior changes can occur, sleep issues where restless and nightmares and just not sleeping properly, tremor as well as dry throat can occur. Drug interactions. It's generally recommended that you avoid taking clonidine with NSAIDs. NSAIDs are ibuprofen, naproxen, under the brand names Advil, Aleve, others like meloxicam, simply because the NSAIDs are known to increase blood pressure, and if you're trying to control blood pressure with clonidine, you're going to be fighting against each other. So NSAIDs, typically not recommended in anyone who has difficulty controlling their blood pressure. TCAs, tricyclic antidepressants like amitriptyline and nortriptyline, can interfere with how clonidine works. Beta blockers and calcium channel blockers, they can also have effects on heart rate and blood pressure, so it may be counterproductive to be using those along with clonidine. Your healthcare provider will, of course, determine what medications are appropriate to use together with this. And we want to avoid alcohol with clonidine. Alcohol can cause blood pressure issues while you're consuming alcohol. It can cause your blood pressure to drop, and as the alcohol gets out of your system, we can see the blood pressure spike again. So if you're trying to control your blood pressure or you're having heart and blood pressure issues, it is best to avoid alcohol altogether. Other interactions can occur as well on a smaller scale. Always be certain that your healthcare providers are aware of the medications that you're taking so you can be screened for drug interactions. I do appreciate you watching this video, and I would be grateful if you'd like this video and subscribe to my channel. And as always, this is informational purposes only. It's not to serve as a substitute for your healthcare provider. Thanks again for watching.